Hello everyone, I am Dr. Gaurav Mandhan from Director and Consultant Neonatology and Pediatrics from Miracles Healthcare, Apollo Cradle Hospital, Sector 14, Gurugram. Today I am here to discuss with you one very important topic of vitamin D deficiency in children and its consequences and how to prevent and treat the deficiency of vitamin D in children. So if you see, there are multiple studies from Western world as well as from India that the deficiency of vitamin D is prevalent in the children is actually, and this deficiency is very common, and figures vary from studies to studies, but anyways, just for a remembrance, you can think more than 50% of the pediatric population, you do if you do vitamin, if we see the vitamin D status at any point of time, they are actually deficient in the vitamin D. So this vitamin D deficiency can present with the different symptoms at different age groups. So if you see, if the during newborn period, if the mother is deficient in vitamin D, then this newborn baby can have a symptoms of low calcium levels and can present to us with the seizures or even sometimes breathing difficulties. As the kids grow, if they are not being supplemented on a regular dose of vitamin D, they have a chances of developing a disease which is called as rickets. Rickets is nothing but it's a disease of growing bones, where the due to the deficiency of vitamin D and deficiency of calcium in the blood, the bones become softer and softer, and usually because of soft bones there is a malformation of the bones which occurs and which can lead to the various bony deformities in the children. So let's talk about how to prevent it. Nowadays, as per the Indian Academy as well as from the American Academy of Pediatrics, we need to supplement these children soon after the birth who are on the exclusive breastfeeds, because nowadays the maternal status regarding the vitamin D is also deficient, and we need to supplement the newborns from the very first day of the life, and usually the dose which is required to prevent the vitamin D deficiency is around 400 international units per day. As per the WHO, we can go up to and also as per the European guidelines, we can go up to 800 to 1000 units per day. Preterm babies who are born at less than 37 weeks of gestation, or even more preterm babies who are born less than 32 weeks of gestation, they are also at the risk of disease called as metabolic bone disease, or also called as osteopenia prematurity, and their requirement for calcium and vitamin D are actually higher. So in term babies, once they are born, the 400 international units of vitamin D, if are supplemented, are enough. However, in preterm newborns, we do require a vitamin D supplementation up to 1000 or even sometimes more vitamin D in case of preterm babies, and this vitamin D is being supplemented with calcium to prevent the disease of osteopenia of prematurity. We have seen that the majority of the kids are till 2 years of age are on some form of vitamin D supplementation, and if you see, the incidence of vitamin D deficiency during this age has drastically reduced because of the regular supplementation of vitamin D. However, if you take the babies above 5 years of age, still almost around 60% of the baby children are still deficient. The most important symptom here is fatigueness or legs pain which the babies they have, and this might occur due to the vitamin D deficiency in these kids. So all the babies, all the children or school age group who are having these symptoms should be screened for the vitamin D levels. School age group who are having these symptoms should be screened for the vitamin D levels. School age group who are having these symptoms should be screened for the vitamin D levels, and the vitamin D levels, if they are less than 30, are considered as deficient. So in case you have any doubts regarding the vitamin D supplementation or regarding the treatment of vitamin D deficiency in pediatric age group, you can contact us. You can put a comment, you can put a comments in the chat box, or you can also ask us questions directly. We will be very happy to answer to your queries. So thank you everyone, and uh, hope to see you back with the good questions, and we are ready to answer any of your doubts.